I'm Linda Vail. I'm the Ingham County Health Officer. So the Michigan State process is basically a drive-through process. So we're out at the Pavilion. We basically, cars come in from Forest Road down Pavilion Road and start lining up to come in. We bring in about 60 cars every half an hour, so about 120 an hour, sometimes a little more. We line them up in lanes in between those posts, kind of like a parking garage has the lettered posts, right? And then basically registration comes by and makes sure they have their forms, leaves it on their windshield. The vaccinator comes by, checks the form, vaccinates them. And then an observer is responsible for just kind of, walking up and down that lane of cars, 10 cars, and ensuring that we don't have any issues with adverse reactions and things like that.
I feel awesome. I work at our state lab, so I work with it every day, and so I'm super excited.
I'm excited. I'm looking forward to safe travel. I've canceled a lot of vacations, and I can't wait to safely get on an airplane again. It was very smooth, well organized, went like clockwork. There's nothing to be afraid of. Everybody should get the vaccine when it's offered to them.
As soon as they can, because otherwise we're not going to reach herd immunity, and we're going to be wearing these masks forever.
Right now we are, we've got 1A, the rest of 1A and 1B going parallel with each other in terms of that, those essential personnel. And then we've also got 65 and over registering, but we're prioritizing 70 and over first. We get about 2,000 doses of vaccine a week. The guidance from the state is that we use 75% of that vaccine on our 65 plus and 25% on our 1B frontline workers. We've got to encourage everybody to get vaccinated, including, college age people. It's approved for 16 above. The Moderna is approved for 18 above. And we can vaccinate college age people, and we should. Our hope is that we just keep getting those messages out about how important it is and how safe it is. People are concerned that it went through trials fast and that it's an experiment. It's not. I used to work in drug development. Rest assured, it would not be available for the public to use if appropriate clinical trials had not happened that demonstrate safety and efficacy. We just have to keep communicating about the various concerns because they're different concerns and they come from different places. Some of them are cultural, some of them are ethnic, some of them are political, some of them are, age related. It's like, sort of like flu shots. I'm young and healthy. I don't need it. It's not going to affect me. We have lost 4 people in their 20s in this county. So of all of those deaths in this county, 4 of those people were in their 20s. And that number may change soon because we have one more that is being looked at as potentially a COVID death that is actually a pediatric one. So rest assured, it is important. Young and healthy, whatever, something can happen. And we don't want that happening. There are people that are concerned because as soon as you hear the word RNA, it's like, oh, wait a minute, you're shooting RNA into me. That's gonna incorporate itself into it's gonna cause something to happen with my DNA or whatever, which is preposterous. If you understand how viruses work, you should understand that if a virus isn't changing your DNA, then neither is a little tiny piece of that virus that we're using to create this immune response.